In this video today, we're going to talk about shoulder pain treatments and compare one versus the other for what might be the right option for you. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who teaches patients about their options for pain relief, improved function, and how to be able to punch pain in the face and get back to leading the life that you deserve. Today, we're talking about shoulder pain and different treatment options. The shoulder itself is a really complex joint. It is a joint that is surrounded by something that's called a rotator cuff, which is a collection of muscles that help hold it in place, as well as allow for it to be able to function in a proper range of motion. Traditionally, options for pain relief and improved function is centered around physical therapy, oral medications, and potentially injectable steroids for relief. Nowadays, when we think about shoulder pain and how to be able to improve it, frequently we talk about the utilization of things like stem cell, PRP, shoulder replacement, reverse total shoulder, or shoulder treatments using radiofrequency ablation. So how does one really kind of sort those things? What are they, and how can they be able to be selected by you to figure out what is going to be of value versus not? When we talk about looking at regenerative medicine, it actually is a much broader spectrum of treatments that fit within something that's called an orthobiologic realm. So ortho being bone and musculoskeletal in nature, biologic meaning is coming from the context of biology or from you autologously. When we discuss radiofrequency, normally what we're using this in context is the application of a certain type of needle with an element that provides heat that targets sensory nerves that deliver pain sensations to the spinal cord and subsequently to our perception. When we talk about shoulder replacement, we're talking about actually changing the construct of the joint and being able to provide an artificial joint in some fashion. So with those things as a listing from least invasive to invasive, how would you help select for what's going to be the best option for you? Many patients would say they would defer to their physician as the person who would make that choice. And although that is a good path at times, it's always useful to have some degree of information so you can make a co-joint decision that is able to recognize what are your needs, your interests that your physician may not have the same degree of depth and ability to understand. So when we pursue a regenerative treatment, like any other treatment, it has its possibilities for failure. But the upside to it is that it really doesn't burn any bridges. Traditionally, you're using cells that come from your own body, and you're trying to increase that healing, to rev up the healing process at that site. Many people think that that can only be useful for the context of muscle, but that's not always the case. It could be useful for bone. It could be useful for cartilage. It depends on the type of treatment, where that treatment is delivered in your body, and really how well your body responds to that treatment by its own augmentation of its healing cascade. The nuanced pieces of how well it works for you is very dependent upon the type of treatment and how that physician delivers it and how your body responds. But at the end of the day, it, in my opinion, is a very appropriate starting point. It doesn't damage the tissue, it doesn't harm the tissue, and it doesn't subsequently preclude you from receiving some form of other treatment if necessary in the future. And it very well may prevent you from needing any treatment. You may be able to decrease pain and improve function by pursuing a regenerative medicine treatment route. So that's one. Two is the utilization of radiofrequency ablation. There are a number of nerves that provide sensory information about pain that's present in the shoulder, and they are separate from nerves that control motor function. Targeting those nerves by using diagnostic blockade, which basically means placing a local anesthetic or numbing agent at those areas can help determine, does it provide pain relief? Within some regenerative medicine circles, this has been frowned upon greatly because at the end of the day, you're providing local anesthetic and eventually heat that targets nerves that you're going to damage in the short term. The reason why you're damaging them is to try to be able to decrease your pain and subsequently improve your function. But there's questions about whether those nerves can be selected so that they have no impact on atrophy or decreased muscle, or proprioception, meaning where your joint is and where your body is in space. At the end of the day, there are reasons for why you may select your radiofrequency as a potential option, typically based off of either regenerative medicine may not be financially feasible for you, you may have tried it and it may not have been successful, or you may just have that as a potential option in your nearby surroundings and you don't want to go for shoulder surgery. So does it have a place and a role for treatment for this type of pain? In my opinion, it does. I think patients need to have an understanding that their provider needs to be skilled in understanding where the diagnostic is placed and subsequently where the therapeutic intervention is placed, and being able to judge, was the diagnostic sufficient enough to provide a result that it's worth doing the therapeutic intervention? If so, then you should proceed. If not, you shouldn't. And then finally is the context of shoulder surgery, either traditional or reversal. So a traditional involves mimicking the context of what the normal anatomy is. So the shoulder anatomy traditionally has a glenoid element and it has the humerus that sits in the cup of the glenoid. So glenoid being more medial, present within the axial region of the spine, while the humerus is the bone that exists here. So in essence, a ball in a cup. Traditional shoulder surgery. Reversal is the exact opposite, where you have the cup that sits more in a distal formulation. You have a ball that this sits on top of. Is there a reason and rationale for having a potential shoulder surgery? Definitely, particularly if you have enough damage to that area that you know you can't regenerate it, or you've tried it and it hasn't been successful. You have complete tears of rotator cuff with retraction, at least at this present time, that's very difficult to be able to treat from a regenerative stance. And you potentially have tried radiofrequency ablation in order to be able to provide pain relief, but it hasn't been significant, or you need better mechanical function. So when we look at this with the discerning eye, we can see there's different subset populations that will fit into these categories differently. The fact of the matter is, like anything else in life, all of them could potentially fail. And after doing any of the three, you also may have pain that's associated with it, pain that may have preceded it, pain that may have been diminished because of the procedure, or pain that actually may be worsened post-procedure if the intervention is great enough. And those are things that you have to talk to your physician about. In terms of being able to figure out what's the best option for you, you really need to have a rapport with your physician, as well as an understanding about what each of these procedures entails. Hopefully, this has been helpful for you. Question of the day: have you tried any of these techniques for shoulder pain? Meaning, have you had either regenerative medicine therapy, a shoulder radiofrequency ablation, or shoulder surgery? And if so, can you comment for all our other viewers, what was the impact and how well did it work for you? So people can be able to glean what might be a good option for them. If you found this video of value, please hit the like button. And if you're interested in videos like this, in terms of learning about options that are out there that you otherwise may not know of, please hit the subscribe button so you can really learn more about treatments that can be able to help you improve your pain and diminish it, improve your function and maximize it, and how you can be able to punch pain in the face and get back to living the life that you deserve. Thank you.